wikidonist.com. Truth about tooth.
Hi, today we are going to talk about dental procedures. How is it done? Most of the time people do ask, how is it done? Do you need to grind the tooth? Do you need to make a surgery? So many things about dental procedures has been discussed. So today we are going to talk about how is it done for veneers. Veneers are a common dental treatment which is done for, especially when it comes to beauty and making the tooth perfect and color same and things like that. So there is a lot of apprehension behind it, whether you have to take off the enamel, whether you have to do a crown preparation, without preparation veneers, non-prep veneers. So many are available, and it is a very good idea to do veneers if you have discolored teeth, if you have some broken teeth, and whether to choose direct veneers over indirect veneers, whether to choose a non-prep veneer over prepped veneers, and things like that is a very big question in most of the patients' mind. So today we are going to address that. We will show you how it is done in an animation video. The animation video is from ICE, so thank you ICE for doing that animation video. So now, how is it done? So the whole idea of doing veneers is to change color, in some cases at least. When the colors are different, like if you have a broken teeth which is having an infection, then it will be a little more darker in shade, or if you have some stains on the teeth, or if you have some teeth which is not perfectly in align with the smile, then we do veneers on multiple teeth. So and all the teeth has to look the same. So it's a tricky game. So indirect veneer, or a veneer which is actually taken from done in a lab or a company, is being used for correcting all that color, shade and things like that. So most of the time in that cases we do when there is a lot of change in color, then it is much better to do something called as indirect veneers, which is having a preparation of the tooth, or the enamel above the tooth is actually reduced. So you can, as you can see, we will actually reduce the enamel and then we will make an impression. Then once the veneer comes back, then we will do an etching. What is etching? Etching is basically increasing the surface area of the tooth by actually using a acidic media like phosphoric acid, which is 33%, which is not going to hurt your teeth badly. It is actually used for 30 seconds on the tooth, so that the whole of the enamel is actually etched, so that there will be pores on the enamel, so that our bonding agent can flow into that pores, and then have a tag, something called as resin tag is formed. Once that resin tag is formed, then we will load the veneers with a proper cement. This cement is actually a viscous liquid which is actually bought from different companies, and then it can also change the color a little bit. So there are different types of cements according to the thickness of the thing. If you want to increase the color a little bit, we can actually do it with the cement also, if it is a very translucent one. If it is a it's like an opaque one, then we can use a cement, and we can just cement it without looking at the shade of the cement. Otherwise we can use a darker shade of the cement to actually make it a little more darker, or if you can use a lighter shade of the cement, then we can make it a little more lighter. Sometimes we use a transparent cement. So all these things are depending on how dark your teeth or how light your teeth has to look. So all those things can be done with the cement itself. So you place the cement on the veneer, then we place it on the tooth, and then we slowly press it so that it is seated into the tooth. Once that is seated, then we will shine a little bit of light, and then what you have is actually a flash of that cement which is actually flowing to the sides of the tooth. Once that is also removed, then we will shine the light so that the cement gets set. What does it, is it a UV light? No, it is not a UV light. It is a high intensity blue light which is used, so that the whole of the, some people call it as laser. It is not laser, it is basically a high intensity blue light which is actually trigger that cement to set faster. And most of the cements nowadays we use is actually a dual cure cement. That means that when we start with when you shine the light, the reaction starts, and then it slowly sets within a minute or two, and then we'll polish the whole of the surface and then the sides of the veneer so that it is merging properly with your tooth, and then you can start smiling. So this is the procedure for veneers, especially an indirect veneer. When it is prepared, then it is called as a prepared veneer or a proper veneer. And when it comes to lumineers and things like that, we can even do without preparation, but that will not be able to change the color of your teeth, but it can be used to change the shape of your teeth. So that's the difference between prep veneers and non-prep veneers. This is the procedure for indirect veneers. Now there is something called as direct veneers. What are direct veneers? Direct veneers are done just on the tooth while you are on the chair itself. Now first I told that you have to make an impression, send it to the lab, get the veneers. In this one you don't have to do that procedure. You can actually do it on a single appointment. What is the difference? So one is actually having a ceramic, and this is actually having, nowadays there is nano ceramic or a composite which is used to actually do a direct veneer. In direct veneer, the difference is that it can be done on the single appointment. So if you have a space between the tooth, if you have a broken tooth, if you have a little bit of discoloration, or if you have a patch of discoloration, all those things, then we use a direct veneers. Now in a direct veneer, what we do, we prepare and take off or shallow off whatever actually having caries or having a discolored area, we remove it off, then we actually etch it with the phosphoric acid just like the indirect veneers, and then we etch it. We don't prepare it too much, then we use a composite once again, composite or a nano ceramic. Sometimes we use as nano ceramic is much better because it has much more better polish and things like that. Nano ceramic composite onto that, and then we either use a template. In this case we are using a template. You press it onto the tooth so that the template gives you a proper shape of the tooth, and it is much more smoother. Sometimes we don't need to use that if it is a small area, or if it doesn't have to cover all the areas, then actually we can use it with a manually, we can actually do it. And as it is saying, you have to remove, if you are using a template, you remove the flash and then you cure the whole system using a blue light, and then your direct veneers is done. So indirect veneer is done in 2 appointments, whereas direct veneers is done in 1 appointment. So that's the difference. And indirect veneers are much more color stable, whereas direct veneers are little more less color stable than the indirect veneers, because if you look at staining and things like that, they say that indirect veneers are much better in resisting any staining and things like that. Direct veneers are a little more complicated because sometimes, like if you use a lot of turmeric and smoke and things like that, it is easier to get the color onto that direct thing, but with just a polishing it will also go off. So these are the procedures for indirect and direct veneers. So those people who are doing veneers or planning to do veneers or doing a Hollywood smile, most of the time veneers are the preferred ones. Either a direct or an indirect one can be used, and it can be done even in some cases. Some of the tooth we can do direct veneer, some of the teeth we can do a indirect veneer also, but it is very difficult for the doctor to actually match the color and things like that. So you need an expert to do that. If you are doing a multiple veneers, then it is much better to do one type of veneer at a time, so that everything looks the same, the color, the shape, everything comes much better that way. So keep watching me. I'll be explaining about different types of procedures in dental procedures and things like that. There's a lot of videos which is explaining where, how and when to do and what are the treatments for each and every problem. Please continue watching Wicked Dentist. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi from Kerala, India. So please keep me watching. Please subscribe my videos so that you can keep on watching, and press that personalized bell button so that you will get a video update every time I upload a video or I have an update on the Facebook or WhatsApp or your YouTube and Instagram. We are available. Please look onto it, follow it, and make it a big time. Please share it to people who are actually needing to know more about dentistry. Some people may have some broken teeth here and there. So, or if you see somebody who is not having a pleasant smile, please send it to them, share it to them, and it will help them also to improve their smiles and having a great smile. Thank you very much. I'm Dr. Thomas Nechupadam.
Wikidonist.com. Truth about tooth.